More children are getting COVID-19 and seeing symptoms than ever before. Noah Chass breaks down the numbers here in Central Oregon. Noah, what are pediatricians seeing right now?
They're seeing more tests, more positives, and more illness, Max. In the past month, the number of COVID tests is up 1,500%. That's just tests. Pediatricians say since the start of the pandemic, they haven't seen kids with these kinds of symptoms.
I think the increase in case is really very scary. It's definitely different than what we were seeing earlier on in the pandemic with kids.
The same virus, but a new variant and a new string of issues for children. Brenna Lewis is a pediatrician with Mosaic Medical. She works at clinics in Bend and Redmond and says she is seeing more positive cases than before with more serious health issues.
And not just respiratory symptoms, but we're seeing some GI symptoms as well. And kids are feeling really achy and just uncomfortable with it as well.
Lewis says while uncommon, they are sending more children to the hospital than they were before the Delta variant.
So it's very rare for kids to have serious side effects from COVID, but it's very real when it happens. We're particularly following myocarditis, which is inflammation of the heart. And I know there was a lot of concern around that with regards to vaccines, but the rates are much lower from the vaccination than they are from COVID.
St. Charles currently has no pediatric patients, but has had 33 since the pandemic began. According to the Oregon Health Authority, per 100,000 people, Deschutes County has a pediatric case rate of 306, Crook County a rate of 322, and Jefferson County a rate of 357.2. Across the state, pediatric cases in all age groups are increasing, including those aged 0 to 5 at a rate of 179.6 per 100,000.
And while there is an increase in positive cases among children, I'm told there is also an increase in families asking about and even registering to get a vaccine.
I've had a lot of families who initially were really hesitant, understandably, and nervous about the vaccination coming back, asking additional questions and ultimately getting it, really in particular in the past 2 weeks.
Lewis says this is a positive step, and the best way to protect children too young to get vaccinated is to make sure the caretakers and the people around them are.
I think a really hard part for myself and my colleagues a lot of the time is just seeing cases that we know are preventable, particularly if a child is getting sick from an unvaccinated parent.
And Lewis tells me she is concerned there may be another spike in cases when school starts. She fears students might have to miss out on school due to being tested, being in quarantine, or just because they're sick. Max?